The Secure Pork Supply Plan has been funded through the USDA APHIS, and we've received some funding from the National Pork Board. Our goal has been to develop procedures to allow the safe movement of animals with no evidence of infection in an FAD control area to a pork processing plant or to other sites of production to accommodate the different stages of production. And as Danelle had said, this is voluntary. There's probably going to be some overlap a bit with what Danelle had presented and what Jim Roth had presented this morning, but I'll try to speed through those areas as best, just to try to catch us up a little bit here on time. As Dr. Roth said this morning, this has been a partnership in the plan development through industry, state, federal, and academic partnership. We utilized our working groups quite a bit, and more recently we've done 2 pilot projects that I'm going to talk about and utilize the lessons learned from the pilot projects and how we can improve the plan. We do, in addition, as she said, to foot and mouth disease, also address classical swine fever and African swine fever. And in our talks, we always try to reinforce the fact that it's not a public health or food safety concern. So there are several tools out there to help us control our foreign animal diseases. And as you know, one of them is biosecurity. And with that being the focus of our session, I'm going to try to focus more on the biosecurity component of secure pork, and I'll just be touching on the other components briefly towards the end of the presentation. Also, as I get going here, I'm going to refer to, like I said, this pilot project. And just to give you a little bit of background on the pilot projects, we've had 2 of them. The first one consisted of an intrastate movement only. So we had 3 different movements. We went from a nursery or a farrowing unit to a nursery to a finisher, and a finisher to a processing plant, all within the state of Iowa. Our goal was to see if the production side could be implemented on the sites, as well as getting feedback from one set of animal health officials to see what they thought of our biosecurity surveillance and so on, the components, to see if they would find it acceptable that they would actually give permission for the movement to occur. We took the feedback we got from that meeting. We had all the players. We had state and federal animal health officials. We had employees on the site, veterinarians, management. We had the Institute for Infectious and Animal Diseases, because we utilized Ag Connect to visualize the movement, all the components, National Pork Board, trying to get feedback from all the players as to how they thought the components of the plan, if we included what we needed to include, and if it could be implemented on the site. It doesn't do any good to write the best plan if the producers can't utilize the plan that we write. So then the second pilot was an intrastate movement. So that was a movement of animals that just occurred regularly between Illinois and Indiana. So we wanted to get the feedback from animal health officials from 2 different states, and again, totally different situation, to see if they also could implement, with the changes we made, the plan on the production site. And then we also have incorporated some lessons from the high path outbreak. So you'll hear me tell you throughout what kind of lessons we learned and how we changed the plan. Danelle had mentioned the biosecurity officer. That's something that we've added because of the high path AI outbreaks. As she said, that's now something that's included across all the plans. The idea is that the officer utilizes the officer information manual, the self-assessment checklist, writes a site-specific biosecurity plan. We utilize the assistance of the herd veterinarian for this in our pilot projects. They're responsible to make sure that the employees are trained in biosecurity on the site, ensure that the site's compliant, and we piloted this concept. So I'll have a little feedback. So again, the idea of the information manual is the information in there will help the biosecurity officer as they draft the site-specific biosecurity plan. The site-specific biosecurity plan, there's the self-assessment checklist. That's just something that they can utilize if they're in place, in progress, or not in place, to monitor their own progress. But back to the site-specific biosecurity plan. So I have an example here. This is something that, because site layouts are different, we have a set of biosecurity performance standards. And so the idea is that the officer, with the assistance of a veterinarian, if they're not a veterinarian, will write the plan for that site on how they're going to implement all these biosecurity performance standards. We also included a map. So what I did before we did our first pilot, I used to be in practice. So I took a site that used to be clients of mine, and I did a Google Earth map, and I said to myself, okay, if I was this site, if I was the biosecurity officer manager, could I write a site-specific biosecurity plan that would work for this site and also change their traffic flow and dynamics to make it so that all the BPSs could be implemented on this site. So we've had that example of a plan that the officer and the veterinarians could use to kind of give them an idea of what we were expecting to be included in a site-specific biosecurity plan. One of the things that we talk about is the line of separation. And in animals that are housed indoors, as Dr. Roth talked about this morning, we use the line of separation as the walls of the building. So the idea is that the walls help act as a divide between the disease and the animals. So anything that crosses that line, whether it be in the entryway and the loadout, there should be access points and there should be biosecurity measures that take place at those access points. So we call it the LOS access points. So again, these are areas where people, equipment, or supplies crosses. If it's a movement of equipment or supplies, there should be cleaning and disinfection that occurs. Some swine sites will use fumigation, some use ultraviolet light, whatever that they choose to use, again, that they can write the plan according to what works on their site. The movement of people through the LOS would require specific biosecurity attire. If there's showers, presence, of course, showering in, a Danish entry system in some form that they have to change their, whether it be clothing or coveralls, that's up to the site, what kind of footwear they want them to wear, washing their hands as they cross that line of separation. Something that's unique to the animals that's raised indoors is the perimeter buffer area. This is something that was the brainchild of Jim McKean, and he was very passionate about having this buffer area. The idea is that it's an area around the buildings that if you can try to minimize the amount of viral load around the buildings, it'll help take that stress off that line of separation as you cross into the buildings. So when you, and I'll show some diagrams here, but the idea is the buffer area, that for people to access the buffer area, they have to take specific measures to enter the buffer area. And you try to keep items that aren't cleaned and disinfected regularly outside of that buffer area. That way employees on the site can move around a little bit more freely, although they still have to take measures when they enter into the buildings. The way that they enter into the buffer area are through clearly accessed, again, the PBA access points. So as I stated, you know, it's the movement of equipment. So if they need to bring a skid loader into the PBA, or people need to cross over into the PBA, they need to take specific measures as they're entering the PBA. So this is an example. Dr. Ross showed it this morning. I have a couple different ones here. So the idea is that as like a vehicle comes through the entry gate, that they do not need to be cleaned and disinfected as they enter onto the site. Again, the idea here is with weather conditions and things, how often can you get a really good clean disinfectant, especially in Iowa in the middle of winter. So if you can minimize the amount that you have to do that because you're not sure how effective you'll be in doing it. So, for example, a feed truck comes into the site. It comes obviously through the entry gate. It stays on the gray path there, but the perimeter buffer area is that bluish green area. So as long as it stays outside of there, and then as people enter into that, so if the feed truck driver, right now, it's not uncommon for a feed truck driver to be asked to slip on booties as they get out of the feed truck. We just have them, instead of getting it out of the feed truck, we have them put them on as they cross into the PBA if they have to open the bins. So again, you're maintaining that PBA, not where the vehicle's driving, because we accept that as already be contaminated or possibly contaminated. So if they take the measure and they enter into the PBA and they put on their special booties, or if they need to bring equipment over, they have a special place where they can clean and disinfect as they bring that equipment in. Again, trying to minimize the amount of viral load into that PBA area. The idea that employees and visitors' vehicles aren't going to be cleaned and disinfected on a regular basis. They, of course, would then park outside the PBA. Employees, as they enter, you can see we have them not even crossing in the PBA. They go straight into the LOS because we feel that they could implement those measures strong enough inside at crossing the line of separation to prevent them from entering the building. And again, you can see there'd be the LOS access points. Maybe at the back of the building there may be an access point if that's where they remove the deads. Again, they're crossing that line of separation. Biosecurity measures have to be followed. The front of the building, if that's where the loadout is, again, they're going to have another biosecure entry point if that's where the loadout is. So again, the idea is that they can customize it to what works best for their site. This is another example. And the purpose of this example is, as many of you know, you may have a site that has, in this example was one that was 4 1,000 head finishers. So in these finishing buildings, some of them are now starting to build an entryway so that they can change coveralls or boots or do biosecurity entry as they walk into the finisher. Others don't have that. So having the perimeter buffer area in a situation like this, you can see at the top of the employee building, the idea is that's just a small employee building. They enter, they cross over a line of separation as they would if they were entering the buildings, and they come out the other side into the perimeter buffer area. Again, the idea is a lower viral load in that area, and then they can walk to each of the buildings. Again, as they go into the building, they walk inside the building and they have another line of separation. From their traveling from the employee building into the finisher building, the most thing that they have at risk would be their footwear. So the idea is, because you don't have room for coveralls and all these things right inside the finishing building, but you could establish a line of separation on the floor. You could have an extra pair of boots, especially in these situations. There's probably one person that's taking care of these. They change their boots as they go into the building to prevent bringing the virus into the building. You could have just a very simple hand washing station there that drains into the pit, so that they could follow those biosecurity measures as they enter into the finishing building. There's many other ways that this could be done with different layouts of sites. This just is a couple kind of ideas that we work towards. We talked a little bit about employee biosecurity training, and as we started to add this as a BPS or a biosecurity performance standard, we got to thinking exactly what opportunities do we have out there right now for employees to be trained in biosecurity. So we went ahead and came up with 4 narrated PowerPoints is what they are on biosecurity. The first one is an introduction. They're all 5 minutes or less. Gives the employees an idea of what biosecurity is about. Then the next one is do not bring disease to the site. So it helps remind them that when they're to come to work, they're supposed to have been showered, changed into clean clothing and footwear, not wear footwear to the site that they would wear to other places, especially out to do their own chores or hunting or to the zoo with their family. And then the last 2 are on the perimeter buffer area and the line of separation to help explain those concepts to them. Each one has an accompanying quiz, a 10-point quiz. We started off with these. Our center does a lot of online training, so we started off with these as online modules that employees could get on and do in their spare time, and we went to our first pilot project. The veterinarian that was training the employees had the wonderful idea of they have these things called staff meetings that they could do group training with the employees. And so that's how we actually did the group training or the employee training in both of our pilot projects. They sat down with the group, they gave them pizza, they had them watch the narrated PowerPoints, they distributed the quizzes, and then they reviewed all the quiz questions together. Online, if you take it, you can take as many attempts as you want or as you need to get an 80%. Once you do all 4 modules at an 80%, you get the certificate. The certificate is proof, if the site's audited, that their employees have actually participated in the biosecurity training. In the group situation, we don't care necessarily what grades they get. The whole idea is that they understand the material. So in the group training session, as long as you have someone like the veterinarian going over the questions with them, we're good with them getting the certificate at the end of the training. We are translating all these to Spanish. An interesting thing, before we've gotten them translated, in our second pilot project, they had 2 Spanish-speaking employees sitting in on the training, and they knew that ahead of time. They had a translator, so the training took a little longer. They had the translator translating with the employees as they went through it, but they said that it worked really well. One thing that we found is, we're, a lot of times we're used to writing questions for vet students and such, and so the first round we found questions that were maybe a little bit too, you can't say A and B or A, B and C or A and D. And so we went through and fished all those questions out. And then we found after the second pilot, they said that everyone did well except for a couple trick questions. We didn't think we had any trick questions left. So we had their quizzes, so we knew which ones they missed, but we thought we'd take it to a new level. We thought we'd take it to the local high school. I have a son in high school, went to the FFA teacher, ag teacher, and said, could you have these high school kids thinking high school education type, let's see how they do with these questions. He offered them 50 points extra credit if they would go online and take the training modules, 4 of them. So I knew my son and a bunch of his friends always need extra credit, so they were going to take them. So my oldest anyway. Yeah. So I talked to Logan, and he said something about taking the modules because he's in a couple of the biosecurity pictures. Anytime I need pictures at home, I stage family members putting on the coveralls or the boots. So they thought Logan was quite the star, that he was some of the pictures in the module. But I asked him what he thought of them and things, and he said they were much easier to take after you watch the modules, which tells me that high school students, to save time, they're going to take the quizzes first, see how well they do, then determine if they need to watch the module second. So we had to cipher through those quizzes just a little bit, but it actually helped us get some good feedback. Another thing that we've done on the pork side is that we've done some auditing for the pilot projects, the biosecurity audits. In the first one, we had a veterinarian who was very familiar with the site go through and audit the site. In the second one, we had somebody who knew very little of the site. In the meantime, we had developed this handbook. So the idea was that they could take the handbook with no other training and see if they could go and audit the site. So we learned about what we had in the handbook and what we needed to change, also with if they were able to audit the site. So that was a good review for us. As Danelle said, we also have some biosecurity posters up here. We have those for producers and employees, and one for visitors. They were developed several years ago with funding through National Pork Board, and we did it as a collaboration with USDA, Pork Board, AASV, and they're in English and Spanish. I'm going to just really quick go through a couple other components of the plan so that you do understand we're not just focused on biosecurity. We do believe in traceability, and we require to participate, you need to have the premises identification number for the site and maintain up-to-date production records in an electronic format. Surveillance is an important component, whether it be sample testing, collection and testing, herd health monitor training, or observations and documentation, and I'll briefly get into that. For our pilots, we didn't actually do the collection, but we have in the plan to do PCR. The industry, of course, would hope for oral fluids because that's something that they are routinely collecting right now, and could easily ask the producers to collect those samples as they did on the poultry side. So the question right now is still if we can get those validated. There's some talk that they're getting close for the different diseases of oral fluids as a testing sample being validated. In addition to the biosecurity training, we have these herd health monitors, which are individuals that see the animals on a daily basis that are looking for the clinical signs. So we have 5 modules, an introduction in what their role is as a herd health monitor, who can become one, the 3 diseases, just so that they know what the clinical signs look like and what we're asking them to look for. And then the final one is how they fill out the paperwork. So again, completion, testing, there's quizzes to go with them. They get their certificate. For our pilots, we did ask them to document under their daily observations for 14 days prior to the movement, to record the number of deads, which of course they already do in the buildings, to also record the number of animals treated by injection, and then they entered those into a data portal, which is what we used for our pilots. So the animal health officials that were determining if the pilot would be allowed, or if the movement would be allowed to occur, could look at they could look at the biosecurity plan, they could look at the fact that it had been audited, they could look at the surveillance information. We didn't do testing again because we didn't want, our pilot was focused on classical swine fever. We didn't want them to submit samples and be fortunate enough to come up with a false positive and be quarantined because they were gracious enough to help us with the pilot project. So we didn't actually submit samples. And we do have a few other resources. We do have also a pocket guide. The interesting thing with ours is it's domestic swine on one side and feral swine on the other. Also translated to Spanish. We have posters. The pocket guide was through USDA funding. Then we have disease posters, ASF, CSF also, that were funded through the National Pork Board. Just quickly, we did ask them for the pilot to fill out an EPI questionnaire, which also was uploaded that the animal health officials could look at as far as risks. And then we did require movement permits, just for the movement itself, not for anything else on the premises. As we worked through our exercises, we determined that it would be beneficial to have a web page that producers could go to. So we have a draft one. We're still working on editing it. Gives them the steps of what they need to do if they were to enroll or participate in the Secure Pork Supply Plan. And then we also found it beneficial as we were talking to animal health officials to have a site that they could also go to help them understand if they're approached by producers in their area to get a better understanding what secure pork is. So we're still working on editing those a bit, but they're there. And then, as Danelle pointed out, we have a website, constantly updating it, but you can go there for more information.